A mental disorder that involves recurrent irresistible urges to pull out hair is called A. Tourette's syndrome, B. Trichotillomania, C. Dystonia, D. Mobius syndrome. And the correct answer is B. Trichotillomania. Trichotillomania is also called hair pulling disorder. Trichotillomania is a mental disorder that involves recurrent irresistible urges to pull out hair from your scalp, eyebrows, or other areas of your body despite trying to stop. Hair pulling from your scalp often leaves patchy bald spots which causes significant distress and can interfere with social or work functioning. People with trichotillomania may go to great lengths to disguise the loss of hair. For some people, trichotillomania may be mild and generally manageable. For others, the compulsive urge to pull hair is overwhelming. Some treatment options have helped many people reduce their hair pulling or stop entirely. (17D) vaccine is given for which of the following disease condition? A. Polio, B. Leprosy, C. Yellow fever, D. Whooping cough. And the correct answer is C. Yellow fever. The diagnostic technique used to detect congenital anomalies in utero is A. Amniocentesis, B. Alpha-fetoprotein test, C. Chorionic villus sampling, D. All of these. And the correct answer is D. All of these. Chorionic villus sampling and amniocentesis are prenatal diagnostic procedures. They are used to check for certain congenital abnormalities and genetic conditions in a developing fetus. Alpha-fetoprotein blood test is used to check a developing fetus for risk of birth defects and genetic disorders such as neural tube defects or Down syndrome. The function of cerumen is A. Protect the ear canal from infection, B. Provides protection from bacteria, fungus and insects, C. Protect ear canal from water damage, D. All of these. And the correct answer is D. All of these. Cerumen can provide protection from bacteria, fungus, insects and water. By shedding dead tissue and lubricating the canal, the ear is cleaning itself to ensure vibrations can pass easily through to be transformed into sound. The cerumen acts as a stopping point for bacteria and fungus, causing them to get stuck in the sticky wax. These harmful substances then leave the body rather than penetrating further into the ear canal and causing damage. What is the full form of AEFI? A. Adverse events following immunization, B. After effects following immunization, C. Adverse events following injection, D. After effects following injection. And the correct answer is A. Adverse events following immunization. National Vector-Borne Disease Control Program covers the following diseases except A. Lymphatic filariasis, B. Japanese encephalitis, C. Leprosy, D. Chikungunya. And the correct answer is C. Leprosy. Directorate of National Vector-Borne Disease Control Program (NVB-DCP) is the central nodal agency for prevention and control of 6 vector-borne diseases, that is malaria, dengue, lymphatic filariasis, Kala Azar, Japanese encephalitis and chikungunya in India. The immunoglobulin which protects the newborn against enteric infections is A. IgA, B. IgD, C. IgG, D. IgM. And the correct answer is A. IgA. A large part of immunoglobulins excreted in milk are IgA that protect mainly against enteric infections. The specificity of maternal milk IgA is driven by an enteromammary cell circulation. Human milk also contains anti-idiotypic antibodies capable of enhancing infant antibody response. Gangrenous stomatitis is also called A. Noma, B. Cancromoris, C. Glossitis, D. Both A and B. And the correct answer is D. Both A and B. Gangrenous stomatitis is also known as Cancromoris or Noma. It is a severe and aggressive gangrenous process that affects the mouth, nose and lips. Rousing's sign is seen in A. Cholecystitis, B. Pancreatitis, C. Appendicitis, D. Gastritis. And the correct answer is C. Appendicitis. Rosewing's sign is a classic clinical feature found in patients with acute appendicitis. Rosewing sign is commonly used to describe pain elicited in the right iliac fossa on deep palpation of the left iliac fossa. Risus sardonicus is seen in which of the following disease condition? A. Measles, B. Smallpox, C. Poliomyelitis, D. Tetanus. And the correct answer is D. Tetanus. Risus sardonicus is also called rictus grin. It is a highly characteristic abnormal sustained spasm of facial muscles that appears to produce grinning. It may be caused by tetanus, strychnine poisoning, or Wilson's disease. Drug not given in pregnancy is A. Labetalol, B. Methyl-dopa, C. Penicillin, D. ACE inhibitors. And the correct answer is D. ACE inhibitors. ACE inhibitors are contraindicated in pregnancy because of the increased risk of fetal renal damage. It is well accepted that ACE inhibitors are contraindicated during the second and third trimesters of pregnancy. However, usage in the first trimester has not been associated to negative fetal outcomes. The function of flame cell is A. Excretion, B. Digestion, C. Respiration, D. Reproduction. And the correct answer is drop your answers in the comment section below. For downloading PDF content and for latest updates, follow our Telegram channel. I have given the link in the description below. If you like this video, don't forget to hit that like button. Thanks for watching.